Hello, AZHP Tech. Aslam, how are you? Yes, they will join you, Aslam. Sit, nine.
Get checked out, don't wait until you can't breathe to go get help.
Before it happened to you, did you believe it? Did you believe it? Even at first, did you really believe it?
I completely believed in COVID. I've seen it for myself, all the patients that are so sick and taking so long to recover. I 100% believe it, but I just never thought that I would be here.
Have you been in contact with, or has someone been in contact with all the people in your life that you may have been close to over the last few days or before you were admitted when you might have been sent to med?
Yes, I've, reached out to, my healthcare, other people I've worked with and friends and everything and let them know that I'm here with it.
If there's one message you want to send to people like you, people in their 20s, or people in Texas or in the country who are watching this morning, what is that?
No matter how healthy you are, no matter how young you are, you have to be careful. These are crazy times and you never think it's going to happen to you, but I'm a perfect example. Just take every precaution, wear a mask, don't go out if you don't have to. It's not worth it.
It is not worth it. Heather, you, all the work you've been doing to battle this virus, and thanks for the message you're sending this morning. We wish you the best of health and a speedy recovery. We know you'll be back soon for being patients again. Thanks so much.
Thank you.
24 years old, even an ICU nurse, Allison, she didn't think this was really supposed to happen.
Well, it's not. It's not supposed to happen to somebody in their 20s where she get the crushed glass lumps. Like you can see, as you said on an X-ray, This is what is so mystifying and pernicious about this disease is that she looks great. Even though she's in her hospital bed, she looks rosy cheeked, she looks healthy, she looks great. And only because they saw that x-ray do they know the havoc that this disease this virus is wreaking in her lungs. I mean, who knows how long that damage will last? That's what is so frightening for some people.
She was going down. Dr. Brown said, had they not caught her and got her in the hospital, she could be in
What are they at?
And I also will say, being in the hospital, not or 24-year-old is a pretty extreme thing. And of course, the more 20-year-olds that are in the hospital, these hospitals fill up. It taxes the capacity. Our floor this morning, even more alarming. They're saying the number of older people, the number of seniors has jumped over the last 2 weeks.
As they predicted. That's not when 20-somethings gets.
President Trump is watching this morning. There's an election in America today, and he has a huge vested interest. His former Attorney General Jeff Sessions running for his old Senate seat in Alabama. The president, he is all in this race. He wants Sessions to go down. What predicts next?
Empty streets, closed business signs Americans won't soon forget. And a new study suggests that we haven't done all that we did. Staying home, closing schools, restricting travel, staying socially distanced from the beginning of the pandemic through early April, there would be about 60 million more coronavirus infections nationwide. The research published in the scientific journal Nature used a modeling technique typically used for estimating economic growth. The study included data on daily infection rates, changes in coronavirus case definitions, and timing of large-scale shutdown policies, but it had some limitations, including that available data on infections and measures across the country studied were limited, and researchers could only suggest estimations about what could have happened.
Greater contraction. Acts great frequency.
Scott Piper in 3 months of HBO Compact on us and stream YouTube and iPod at fiber-fast speeds. Let's stay together and enjoy at home with Sky Fiber.
Undercover Breed
a lot of our frustrations right now is people don't have enough of it. They're stressed out about it. And this is a problem we can actually solve.
I've been watching an old moment, and this is
It is election day in America. Jeff Sessions, in the fight of his political life this morning, the president's first attorney general is scoring off against former Auburn football coach Tommy Tuberville. In Senate runoff in Alabama, the president has endorsed Tuberville and continued his race Sessions without mercy. Our Jeff Zeleny has been covering this race. And Jeff, to say the president is endorsing Tuberville was understated.
Good morning, John. It would be an understatement. In fact, as we know, Alabama voters have sent Jeff Sessions to the Senate 4 times before, often without opposition. But the headwinds he's facing now are because of President Trump. But the primary today will determine if the president
Hello, guys.
against Senator Sessions. Jeff Sessions has never lost a political race.
What I'm saying to people of Alabama is, I can represent you.
In the fight to get his old job back as senator from Alabama, he's the clear underdog. A Republican primary against former Auburn football coach Tommy Tuberville would be hard enough.
Jeff Sessions quit on the president and he failed Alabama.
But it's made even harder when the real enemy is President Trump.
Jeff Sessions was a disaster as Attorney General.
The president still carries a grudge against Sessions for accusing himself from the Russia probe. He's been obsessively tweeting about the Senate race, including this weekend missive, with the president fuming, "We don't want him back in Washington." The Alabama Senate race is all about Trump.
Not complaining to President Trump and his agenda.
In Deep Red, Alabama, loyalty to Trump is paramount.
Hello, welcome to my
Voters said 5 years ago he was one of the only U.S. senators to take seriously Trump's White House bid. But through more than $1 million in TV ads, Tuberville is blasting Sessions for being exiled from the administration, and in a bit of cow-snapping locker room talk for being rude.
Are you strong or you're not? Sessions, he's not. He wasn't man enough to support President Trump when things got tough.
Sessions has returned fire.
This is no fresh face. This is a 65-year-old former football coach who did 4-8 in Cincinnati and was terminated. This person does not have a record of political conviction.
Watching it all is Democratic Senator Doug Jones, who narrowly won in a 2017 special election. In November, it's still an uphill battle for Democrats to hold the seat. The Republican runoff will test Trump's ability to influence a race or show whether old loyalties hold more value.
Donald Trump is not on the ballot this time. Tommy Tuberville is. The choice is between Jeff Sessions and Tommy Tuberville.
Now, the president wanted to fly to Alabama to hold a rally over the weekend. He was urged by the state's Republican governor not to because of the rising cases of coronavirus. So, John, in a voting primary in a pandemic during a summer runoff, unclear how many voters are actually going to turn out. But Jeff Sessions said the people of Alabama will decide this race, not those in Washington. We'll see.
In a huge scandal in Alabama standards, the president repeatedly referring to Alabama coach Nick Saban as Saban yesterday, correct?
He did that on a call last night with the Tuberville supporters saying Lou Saban, of course, Nick Saban, Roll Tide Alabama coach, and that's another subset here. What do Alabama fans do? Do they go for the Auburn coach, or do they not? We'll see.
All right, Jeff Zeleny for us covering this. Thanks so much for being with us this morning. Got it. You need to continue right now.
California shutting down again as cases skyrocket.
We have to control these numbers. These numbers are out of control.
It's no secret we're heading to the other side of this pandemic. We're testing, and we're failing with contact tracing.
There's no opposition research being done to reporters. Dr. Fauci and the president have always had a very good working relationship.
We are certainly freezing him out. They sidelined him. It's horrible. We're not going in the right direction. We know that. See the numbers. This makes it even worse.
This is New Day.
with Allison Camarada and John Berman.
Good morning, everyone. Welcome to New Day. Major changes across the country this morning and new signs, perhaps, of what is to come and new trends that raise serious concerns. California is banning indoor dining, closing movie theaters and bars because of the spike in coronavirus cases there. Much of the state is also closing down hair salons, gyms, and churches. 3 of the nation's largest school districts, Los Angeles, San Diego, Atlanta, they announced that students will not be back in physical classrooms this fall, and despite threats from President Trump to withhold federal dollars. This morning, 37 states are reporting increases in new cases.
And if you've tried to get a test for COVID, chances are it was harder than it should be. The president's former chief of staff, Mick Mulvaney, tried for his kids, and even he, one of the most connected people in Washington, could not get results quickly. He's now calling the testing situation simply inexcusable. There's also a shortage of protective equipment again. A former Defense Department official tells CNN the Trump administration is months behind because they failed to act in the number of patients that are treated 80 years old in just the last 2 weeks. CNN's Rosa Lord live in Miami with our top story. What's happening there this morning, Rosa?
Well, Allison, good morning. It is not getting any better here in the state of Florida. Florida reporting yesterday more than 12,600 cases, and new this morning, we're learning about a big issue that's been lurking under the radar, and that is the need for medical personnel. We just learned this morning from Jackson Health that 200 of their medical personnel are out with COVID-19. The positivity rate for all of the employees that they tested was 23%. That's why it's no surprise that Governor Ron DeSantis announced yesterday that he's upping the number of nurses that he's deploying across the state to 3,000. Here's the reality on the ground in Miami-Dade County. The positivity rate here is 28%. When it comes to hospitalizations, the number of hospitalizations of patients with COVID-19 is 2,000. When you look at that number, the percentage increase in the past 13 days, it's up 68%. The number of ICUs needed, 69%. The number of ventilators needed, 109%. Right now, there are 200 people on ventilators in Miami-Dade County. I just checked the number of ICU hospitals across the state that are at capacity with 0 hospital ICU beds available is 48. 8 of them are right here in Miami-Dade County. Now, as leaders refuse to roll back any of the reopening plans, the frustration from residents is boiling over. I was at a Governor Ron DeSantis press conference yesterday when Thomas Kennedy interrupted the governor with this. Take a listen.
So I think
and you are taking the promise that are no plan and you say nothing.
The company is escorted by security, and Allison, he said he was frustrated, that he wanted his voice to be heard, that he's tired of the failed leadership, and that one simple thing that Governor Ron DeSantis could start doing is masks statewide.
Thank you. It's now CNN Chief Medical Officer because some of the news and information we're just getting from Rosa out of Florida is alarming. She says 48 ICU hospitals are now at capacity. That number was 35 yesterday when she reported it. The Miami Herald this morning reporting something that really got my attention, which is that the Jackson Health System, which is one of the biggest health systems in the state, says that they've seen a 100% increase in the number of patients 80 years old and older. So it is now beginning to affect seniors, this surge there. How concerned are you about this?
Well, it's very concerning, and how this virus is going to behave. It did seem to affect this younger demographic. Less likely to get ill. That remains true. We're making things several months ago now. This is how we know that the elderly patients are also have pre-existing conditions. Like ventilators. But we also have a significant number of personnel who are affected by this, respiratory therapists, for example. It becomes one of the rate limiting steps here. How do you take care of patients? Hospital personnel, healthcare personnel themselves either are getting sick or you just don't have enough. That's part of the surge capacity as well. That could be a real limiting factor in Florida, in Texas, and other places.
That's when things got really alarming here in the Tri-State area. When back in March, when all we should just brace ourselves for the death rate to begin spiking, because we were in that crisis where, okay, I guess it's just younger people now getting sick. I guess it's just 20-something-year-olds, but now they're infecting their grandparents. And so does that mean that we should prepare ourselves for a spike in the mortality rate?
Yeah, I mean, sadly, Allison, as I've said so many times on this show, we take no joy in talking about this. I mean,
don't bite that, huh?
Let me show you something that we showed on this program back in March. This goes back to 1918, and there are lessons to be learned. If you go look at what happened in 1918, we know that there was this first infection. The second wave. Look at this graphic, the course of this pandemic. We're still sort of in that first wave to the far left of the screen. We haven't really had a second wave. We have the luxury of a second wave because we never really got out. We're still spiking in this first wave. But the concern, Allison, exactly to your point, and again, very predictable, unless we do something about this, is that the second wave, because we have not only more virus now in the community, far more than we had in February and March, but it's predictably going to start affecting older people. And the hospital capacity ultimately is what really changes that mortality rate. The virus itself, if someone were to ask, look, put 100 people in a room, they all get exposed to the virus. What is the mortality rate here? The reality is we still have a hard time answering that question because it's so affected by how likely someone's to be able to get hospital care, what kind of care they're going to get, all of that. Some people said, look, it's around 1%. 1% of people who get infected will die from this. But if you don't have enough hospital capacity, you're going to have preventable deaths, and that starts to drive up the mortality rate. If you do the calculations on the right side of the screen, it's somewhere between 3 and 5%, much higher than it should be.
It's interesting, Sanjay, that California stepped up and is beginning to close down some of the things that they open. They also have the schools in San Diego, Los Angeles counties will not be reopening physically in the fall. California is in a little bit of a different place than Texas and Arizona and Georgia and Florida. It's still bad there, but their positivity rate is actually only half of what those other states are. So in some ways, they're doing this before or in a place that is better off than Texas or Florida right now.
Yeah, I mean, it's interesting, John, because it's all the context, right? I mean, I think Florida was earlier in terms of when they started talking about shutdowns previously, and I think a lot of the country was thinking, really? You're going to think about shutting things down? Is that really necessary? And then it became obvious, abundantly necessary and abundantly clear that it needed to be done. I think we're sort of seeing the same thing here as well. I do worry that even though they are ahead of this compared to places like Texas, if you don't get ahead of the curve very quickly with this virus, you're behind it. And I worry about that even in Florida. I will say that, we can identify the biggest sort of contributors to spread. And there's no question that indoor gatherings that are unmasked, because people are eating and drinking, such as restaurants and bars, closely clustered together, those are going to be the biggest source of super spreading events. There's no question about that. I think the question now for California and for, several states states around the country is, can you do these surgical strikes or these minimally invasive procedures as opposed to going into a more full shutdown mode? Nobody wants to go to a full shutdown mode. I get that, but is that sort of aggressive therapy what's necessary, over the next several weeks in order to really stop the transmission of this virus, to sort of just stamp it up for a period of time so that we can get our arms around it again?
Sanjay, I feel like we could ask you about antibody.
There's some anecdotal reports that came out of South Korea. The United States, if it were true that you simply lost protection 20 to 30 days after exposure, I think by this point we would have seen definitive reinfection rates, and we really haven't seen it. So that's something to keep in back. Also, I think just more subjectively, if you someone who's been exposed to the virus and you've recovered, even if you've already demonstrated that much of exposed to the virus and recovered. That's a good thing. So that's psychological.
For me, discussion of antibodies is still one of the most important questions out there, Sanjay. So I'm so glad everybody got us around this kind of understanding. The hospitalization in Texas way. Will Texas impose any new shutdown orders the way that California has? Our next guest, who is a very important leader in Texas, says it is time to do so. That's next.
In response to Black Lives Matter protests, some of America's biggest banks are pledging action. Bank of America is committing $1 billion over 4 years to support communities of color through health, small business, job training, and housing programs. Goldman Sachs has deployed a $10 million fund to help organizations fighting racial equality. The company will also match employee contributions to the fund and says the donations of $25 and under will be matched 3-to-1. And PNC Financial Services is investing more than $1 billion to support the economic empowerment of African American and low-income communities.
Ahora sí ya. Apa nih kita?
Even those states that have been able to try to come around and see major declines in the number of cases are going to be really stressed to try and keep that progress going forward. As we think about trying to get the schools open, we have to get community transmission under control. So many states we're seeing just we're seeing areas that we're having low rates of transmission, now seeing much higher rates of transmission. And that's a very dangerous situation when we think about school reopening. It's critically important that all based on the best public health services. We don't want to get into
situation where the science is what goes into a guidance against the lessons. I mean, maybe the policy decisions aren't based solely on science, but the science itself needs to be separated from the political process.
I'm gonna say that.
Florence in London and this.
Yeah.
Texas Governor Greg Abbott is warning that the worst is yet to come. In the past 2 weeks, hospitalizations in the state have skyrocketed 121%. Some Houston officials now calling on the governor to reimpose stay-at-home orders. Harris County Judge Lynn Hidalgo is one of those officials, and she joins us now. Judge, thanks for taking time. California's governor just announced this. He is shutting once again major across the state restaurants, gyms, hair salons. Is Texas about to do that?
There's people mentioned in Harris County, we've got Houston, and 33 other cities that need to see an increase in the ICU population. We see our hospitals recovering at their surge capacity, having to enter doctors and nurses, folks having to wait in the emergency room for an ICU bed for many hours. And we've known all along what we have to do because we did it back in March, and that was impose a stay-home order. Initially, I had the ability to get authority to do that, and once the state started reopening, I was stripped of that authority. So for 2 weeks now, I've been urging residents to stay home, and that's what's really sad is in the meantime, these hospitalizations, these deaths have bring it down, really.
Sometimes after the Cristo.
We back in March, which is essentially give up early in the hope that by saying we're claiming victory, that we're simply going to be victorious as opposed to having to do the work and work until that curve really came down.
So that's what you think happened. You opened too early.
It's very clear that the communities that opened later, once the curve had come down to 20% of peak, perhaps 30% of peak, and that opened fewer things at each stage. Those are the communities that are seeing this more sustainable reopening. Now, it's a new normal. We're not going back to 80% open bars. We're being very, very careful about the schools, not just in this country, but around the world. And that's what we have to learn from. That's what there's a lot we don't know about the disease, but there's something we do know, and we know how to deal with it and get ourselves in a sustainable situation. And I understand folks going in the race to fight that football, to say we're done here, nothing else to see, let's go back to normal. That's kind of what we're seeing with the Texas Education Agency saying schools are supposed to be back in session here in just over a month, August 19th, when we have our hospitals at their base capacity. So we gotta look at this straight in the face and go with that instead of the politics.
So is Governor Abbott going to reimpose stay-at-home orders?
But that's on him. That's why this is hurting our community. It's going to turn this to us, and it hurts the economy in the long haul. The longer we keep this going, pretending like these incremental restrictions are going to fix the problem, the longer it's going to take to recover. And unless we do something like that, the curve's going to, if it ever flattens, soon, it'll come down very, very slowly. It's going to take us even longer to get the economy back on track. And so we have to do that from a public health standpoint, from a moral standpoint, from an economic standpoint. Right now, using every tool at our disposal to explain to the community we need to stay home. I hope folks are listening, but it's not as effective as if we had an order, and it's time to get real. It's well past time to get real, and we can't pick an arbitrary deadline. We have to say that when the curve comes down, then we set ourselves on a path for success based on what's happened in other places.
Are the messages that you're getting through your channels are that the governor is inclined to that? In fact, on July 10th, he said, with the increased death rate you're seeing in Texas, the next step would have to be a lockdown.
Look, frankly, I don't know what we're waiting for. are we, the strategy at some point seemed to be, let's wait for the hospital beds to fill. And what we're seeing is it's not an adequate, perfectly efficient system. It can't just perfectly efficiently transfer patients from one hospital to the next. And so, you know, people are really suffering. Our Hispanic population, we're seeing hospitalization rates 50%, 60%, 65%. We know it's 44% of the population. We're seeing these impacts on our community. We can't possibly open schools, teachers, administrators up in arms, families up in arms about this idea that we can reopen schools when we have so many people sick. These kids go back to school with things like they are. They'll infect themselves, infect everybody from the bus driver to the administrator. And so we have to be honest with ourselves. I've had to make the toughest decisions since I've been in office, and in the time I've been here, I've had to deal with many disasters. But look, we can't have politics in our head right now. That shouldn't be consideration. And it's tough to tell people, well, you have to stay home, but it's better and it's more honest than false hope. And that's what we have to do to put the economy itself also in a position to succeed for the long term. So I continue to ask for that, and I continue to ask my community, you know, let's do this together, let's try to stay home, and I'm not going to promise that it's going to be over in this many days or this many weeks, because nobody can say that. We have to bring that curve down, and the more we buckle down, the faster it'll come down, the faster we'll be able to drop our kids off our school, to ask them about their day, to get on with our economy, not fully open until there's a cure or a vaccine, but in new normal, we've got to stop hampering ourselves in this way as Texans, as folks from Harris County. We've got to work together based on facts.
About the school opening, since Governor Abbott has said a month from now, virtually a month from now, he wants all schools reopened with in-person classes. You're saying that can't happen right now with this hospitalization and positivity rate. So who's going to stop the governor from doing that?
We're seeing around 1,000 new cases per day here in Harris County, about a quarter of the cases in the state of Texas. And the hospitalization is right at the edge of surge capacity. So you open this will spread like wildfire. Some school districts are trying to say, well, we're going to push the reopening. County in El Paso, they've said they're going to ask that the reopening be later. We're watching that to see what the courts do, what the governor does, and learn. But look, they've been threatened. These school districts have been threatened with losing their state funding, which is very important for them if they don't reopen in person a month from now. And it's just an untenable situation. So we're all trying to see what to do. Teachers are resigning, right? Who have these health challenges, who are most at risk. Parents so concerned. I get those calls in my office, and so we also can't give an arbitrary deadline for that. We can't say, okay, school's supposed to open by this day and expect that the virus is going to follow that deadline. And so we've got to learn. There's plenty of examples around the country and the world. Let's say when the curve comes down to this, then we have this hospitalization rate, and actually follow that. Then we open schools and we take these precautions and we watch and we open slowly and we see what happens. There's a smart way to do it. We can't pretend it's a mystery, and we can't put our community through this kind of heartache, worry, and frankly set them up for failure when it comes to the future of our economy and of our education system.
Jocelyn Hidalgo, we really appreciate your time. Thank you very much.
Thank you.
The White House may be backing off the efforts to discredit Dr. Anthony Fauci. Why? What's the latest? What happened in his meetings?
I can sense your anticipation, oh hungry explorer. I'm almost ready. Stay put just a little longer. My temple courtyards, wilderness galore, the enigmatic hinterland, and the calm seashore await your arrival with many a secret to unveil. Plans much, but I keep surprising you all along your trip.
India's best kept secret.
energy houses, and our demand for it continues to grow as our planet endures continuing pressure for more. We face a challenge. Can we reduce emissions and transition to cleaner energy sources?
What happens now is that COVID-19 pandemic sends shockwaves through the energy sector. With crisis can come new opportunity. I'm finding out how the world is adjusting to this new energy reality.
The Global Energy Challenge, this weekend on CNN, in association with BP. Want a daily dose of Fareed and his team? Now you can get it with Fareed's Global Briefing, the newsletter that gives you the best insight and analysis on global affairs. Go to CNN.com/Fareed to sign up. I'm Matt Rivers in Mexico City. This is CNN. Spray connection with Axe. Great fragrances. First impression. Axe fragrances smell great, fresh, and cool.
With CNN Partners, the world is always at your fingertips. CNN Partners, connected to you.
Very difficult employment situation across the world. And thinking about the speed of the recovery and how quickly things can go back to a future rather than normal.
I'm Julia Bowder in Rome, and this is CNN. The notion that there's opposition research and that there's Fauci versus the president couldn't be further from the truth. Dr. Fauci and the president have always had a very good working relationship.
Okay, the White House appears to be backing off their criticism of Dr. Anthony Fauci after that concerted effort to discredit him. Why the change? Joining us now, CNN political analyst David Gregory and CNN political correspondent Abby Phillip. Abby, I get so confused with this episode of As the Stomach Turns. Where are we? Why do they now have a different message? Do they trust Dr. Anthony Fauci, or do they not want to do that?
Well, the press secretary, Kayleigh McEnany, has a different message, but some other White House officials are not necessarily following suit. I mean, look, the White House, it's not just the White House, I should say. First of all, it's a lot of people around the president, his supporters, who he communicates with regularly, or he's aware of what they're saying. They've been skeptical of Dr. Fauci for a long time. This is not a new phenomenon. What is new is that it's boiling out into the public sphere. Regardless of what Haley said in that clip, reporters sitting in front of her in that room were on the receiving end of the opposition research. So her denial that it doesn't exist does not change the fact that they were given it by White House officials who wanted to remain anonymous. I do think, however, that perhaps there's been some recognition that this all-out effort to discredit Fauci is a poor reflection on the White House, because Dr. Fauci is far more viewed far more credibly and as more trustworthy by the American people than the president and by many of the officials in that building. So I do think that they know that they're on the losing side of public polling and public opinion on this issue.
Yeah, put it in the corollary category of attacking the wrong thing. There seems to be a trend here in some ways, David. And I'm focused on a new poll which just crossed for Axios and Ipsos on the issue of opening schools. We've heard from the president and the education secretary over the last few days, damn the science, open schools, I don't care what the risks might be. Well, a new poll out of Axios and Ipsos finds that 71% of parents think it's a large or moderate risk to send their kids back to school. That includes a majority of Republicans. 53% of Republicans think it's a large or moderate risk. And by the way, 9 out of 10 African Americans think it's a large or moderate risk there. So parents are nervous about this, as the president's saying, just do.
Well, I think this is a more nuanced issue, and maybe I'm influenced by the fact that I would like to see my own kids go back to school. And I think that schools need to push to do it safely. Of course, there's risks. Of course, there's a reason to be worried, but I've also been acquainted with schools where the faculty are more concerned than I think what's difficult is that a lot of schools don't feel that they have to go back, and so they're not figuring out how to try to do it safely. So I think this is a more nuanced view. I think there's tremendous harm that's being done with kids losing this much time, and it's the impact on families who don't have work-from home options as well. So this one I think is a more difficult issue. I don't think the president can just come out and say, open the schools by fear. Part of it, putting scientists ahead of figuring out how you do something. It's difficult, but it should be done.
Yeah, I think that not only is it nuanced, but it depends geographically on your comfort level. If you live in right now, if you live in New York or Connecticut, where the cases blessedly are very low, you think, okay, maybe that's a risk we're willing to take. If you live in Texas, you might feel very differently. And yet, as David just pointed out, the president, wants it across the board and has threatened to deprive states of federal dollars. So where are we with that?
Well, they realized that they actually
¿Qué, Ingrid? Hello guys, welcome to my live stream. Ba't nag-iiko? Hello? Hello? Nawawala yung ano ko, nawawala yung video ko. Bakit kaya? Kaya nawawala ito? Anak! Anak! Halika nga si Tay. Halika nga, my love. Kunin mo nga yung mga cellphone. Kunin mo yung cellphone. Nag-i-echo yung ano ko, live stream ko. I-end ko nga muna. I-end.